So I did. I met with a woman, her name is Chris, and she was actually a student of mine, and she said that her son struggled with addiction. She said there was one thing that she wished one of the treatment centers, and her son was in several, had talked to her about addiction, and that was to expect relapses. And she said, I know that that's really uncomfortable for a treatment center to talk about relapses. But the truth of the matter is that addiction is substance use disorders are a chronic relapsing disease like diabetes, asthma, high blood pressure, are ones that we're really, really familiar with. And she said that that would help her be much more prepared when her son did actually have a relapse, and so she would know how to respond in that situation. So why relapses happen is if we embrace the fact that substance use disorders is a disease, which the American Medical Association has, then we expect that it is a chronic disease, and with any chronic disease, relapses will occur. So if we look at what we believe is the relapse rate, according to the National Institute of Drug Abuse, which is 40 to 60%, addiction relapses are actually better than asthma or high blood pressure, which is about 70 to 80%. So what we know about ourselves as humans is we're really not good at making lifestyle changes. So what we're asking people to do who have developed alcohol or substance use is we're saying, you have this disease. So part of this disease is making medical changes. Part of this disease is making cognitive changes. So we're going to do all these cognitive therapies. And part of this disease is making lifestyle changes. We know we're not good at a lot of that as people. Most people don't finish their antibiotics. Less than 10% of the people that get prescribed antibiotics even finish them in the first place. Most people don't finish their diets. So if I start a diet, most people don't finish their diets. We know that people with diabetes, 50% of them, even if they know they're going to lose their sight, won't make the lifestyle changes they need to make. They know that they might lose their life or their sight, and they won't make the lifestyle changes. We as humans aren't great at it. So it turns out the truth is that people with addictions tend to be better at it than people with other chronic relapsing diseases. So we know that with any of these diseases, addiction is one, we're going to expect relapses.